Breathing's important, isn't it? We have to do it every hour of every day of our entire life. So get ready to fill your lungs with lots of air. Hi everyone, and welcome to Exercise for Health. I'm Richard, and today's video will teach you breathing techniques to help you manage health conditions such as anxiety, respiratory diseases like COPD, chronic bronchitis, emphysema, pulmonary fibrosis, bronchiectasis, and even if you don't suffer a health condition but would like to find a way to manage your stress levels. This may even help if you've had the coronavirus COVID-19, but treatment for those with long-term health effects has yet to be determined fully. As a bonus, if you watch to the end of the video, I'm also going to share a technique you can use to reduce your breathlessness while you're exercising. So firstly, to do these breathing techniques, it's best that you're in a seated position with your back supported, where you can maintain a good upright posture, as this will help with expanding your lung capacity. Also, it's important that you use the technique to your level, where you can manage 4 to 5 sets of the breathing exercises without feeling breathless or lightheaded. So with that, let's get started on the first one. Right, the first one we're going to do then is diaphragmatic breathing, which is also known as belly breathing. And the purpose of this is trying to get you to understand the diaphragm, which is a muscle located internally just below the rib cage. We're trying to get it to contract and actually go down, which then helps the lung capacity increase. When we tend to get breathless, what you might see people do, particularly if you see someone having an asthma attack, is they tend to sort of raise their shoulders up, the chest comes up, and that actually lifts the diaphragm up and actually then decreases the actual lung capacity itself. So to increase it, we want to try and expand the belly outwards. So to do this, place one hand on your belly and the other hand on your chest. And what you should find is when you breathe in, if you breathe in through your nose, then the belly will come forward. Your hand on your belly will actually come forwards, but the chest one will stay where it is, and then breathe out through the mouth again. So breathe in through the nose and then out through the mouth. So if you do it correctly, the hand that's on the chest won't actually raise up or come forwards. It would just be the one that's on the belly. And a little tip just to sort of show you really and prove to you that actually you can get more air into your lungs if you are breathing through the diaphragm and through your belly properly, is if I turn to the side to show you. If I actually just breathe in through my chest, so I don't let it go through the belly, so I breathe in, so the chest comes up as far as I possibly can. I can't breathe in anymore, but if I now breathe through the belly even further, I can actually get more air into the lungs before I breathe out again. So it just proves to you that actually if you do breathe through the belly, you can actually open up the lung capacity even more and get more air in. So just to recap, hand on the belly, hand on the chest, and really you should just feel your belly sticking out as you breathe in. And then breathe out through the mouth. Okay, so that's diaphragmatic breathing or belly breathing, so that's the first one. The next one we're going to do is called pursed lips breathing. Now, this one's really good in terms of it just, again, tries to work on the same principle as the diaphragmatic breathing. So you're going to breathe in through the nose and out through the mouth, but as you do this, we're going to time it. So whatever you do to breathe in, however long it takes you, let's say it's 2 seconds to breathe in, then it should take you 4 seconds to breathe out. If that's too easy, you might find you do 3 seconds to breathe in, but then 6 seconds to breathe out. But when you're breathing out, it's a little bit like you're trying to blow out a candle on a birthday cake. So the lips are pursed, and you're breathing out through the mouth that way. So still breathing in through the nose, but out through the mouth. So again, I'll just show you one to give you an idea. I'm going to breathe in for 2 and then out for 4. So breathing in. Okay, so you can do something similar, but again, if you find 2 and 4 seconds is not quite enough, you can increase it to 3 and 6, 4 and 8, even 5 and 10 if you feel that you can do that. So that's pursed lips breathing. Right, the next one we're going to do is called box breathing. Now this one's really good for anxiety. If you suffer from any anxiety, it's a great way just to calm yourself back down again. And in this one, we're actually going to be holding our breath for a certain period of time. If you think of a square shape in front of you like a box, what we're going to be doing is we're going to breathe in for a certain time frame, then we're going to hold the breath for the same length of time, then we're going to breathe out for the same length of time, and then we're going to hold our breath again for the same length of time. So it might be breathing in for 3, hold it for 3, breathe out for 3, hold it for 3, and you go around in cycles. And you should be aiming to do sort of 4 or 5 cycles round, again, without feeling lightheaded or breathlessness. So let's start off with, so again, make sure you're in a good posture. So with this one, we're still going to breathe in through the nose and out through the mouth. So breathing in, hold, out, hold. Okay, so that's box breathing. So you've got the same amount of time from breathing in, holding it, breathing out, and holding it again. And you can repeat that and do that in cycles. So that's box breathing. Right, the next one we're going to do, and this one's called a huff cough. This one's particularly good if you are suffering from a condition like COPD. So bronchiectasis as well is quite good to do this one. This one's a good way to actually try and release any build-up of mucus in the lungs. So even if you've got like a chest infection or something like that, this can also help as well. But the aim is that you're going to breathe in and out through the mouth this time. But on the breathing out, it's going to be in 3 short phases. A little bit like you saying ha ha ha, or if it's Christmas, it might be ho ho ho. So the idea is that you breathe in through the mouth, take a deep breath in, and then as you breathe out, it's really short, sharp breaths out. So I'll try and do one to demonstrate. So breathing in. Then out. 3 fast ones out. Breathe in. Out. Okay, now if you do that too many times, you might start to feel a little bit lightheaded. But again, that 3 huff coughs where you're breathing out quite quickly, that's a really good way to try and expel a lot of the actual mucus that builds up in the lungs. So if you're finding that first thing in the morning, it's feeling a bit congested, then that could be a good way to actually get rid of and release some of the mucus that's built up overnight. So that's called the huff cough. Right, we're now on to the 5th and final one, and this is more of an exercise really, because it's a great way to actually strengthen the diaphragm. It's called sniffles, and basically you're only allowed to breathe in and out through your nose this time, and it might be a good idea to actually blow your nose before you do this one, just in case it gets a bit messy. So I wouldn't advise doing this if you've got a cold. But basically you're going to keep the mouth closed, practicing the diaphragmatic breathing that we did on the first one. Imagine doing that but at a lot faster pace. So again, hands can go wherever you want. You can put them on your belly if you want to see if you're breathing in and out correctly through the diaphragm and through the belly and not through the chest. But I'm going to keep my mouth closed and then so all I'm doing is very, very quickly breathing in and out through the nose so I can feel my belly moving in and out quite quickly. So I know then that the diaphragm's getting a little bit of a workout. So the diaphragm, like any other muscle in the body, needs to be exercised. And this is a good way to actually strengthen that diaphragmatic muscle, which then hopefully then will help improve the condition a little bit. If you've got any sort of health conditions like COPD, you might find it just helps a little bit with that because your lungs will get stronger. Right, in addition to these techniques, exercise regimes such as yoga and Tai Chi can also help practice a wide variety of breathing methods. And you may find some of these useful to help manage your condition. When we exercise though, we all experience dyspnea or shortness of breath, and this feeling is made much worse if you're suffering from a respiratory condition. But it's worth noting that exercise will help improve your cardiorespiratory fitness. So your lungs become more efficient at transporting oxygen to the body, and therefore you manage your condition more effectively in the long term. However, a technique I've learned to reduce the breathlessness feeling when exercising, so maybe if I've worked too hard or if I'm exercising at higher intensity, is to get yourself into a position where you can rest your hands on your knees or your elbows on your knees, so you're in a slightly leaning forward position, and basically breathe 5 quick cycles in through the nose and out through the mouth. But the important bit is to really force the air out the mouth as hard as you can, and you do 5 quick cycles. So if you're in this really sort of high state of breathlessness feeling, first thing you need to do is obviously don't want to then increase the anxiety levels. We need to try and make sure that we don't get back into this form of breathing, that we get straight into the diaphragmatic breathing. So that's the purpose of then putting the hands or the elbows onto the knees, or if you're in a standing position, put it on something solid to stop the shoulders from raising up. And then additionally to that, we also want to try and force the air out of the lungs. And the purpose for that is your brain senses that obviously 1, you don't have enough oxygen in the body, but 2, it's also sensing that you've got too much carbon dioxide in the body. So that's the reason then that your breathing rate will actually increase. So as well as us trying to get oxygen in, it's actually just as important to really force the carbon dioxide back out. Hence the reason why if you really force the air out of your lungs when you're in this position, 3-5 cycles, suddenly the brain realizes that the CO2 or the carbon dioxide levels are beginning to drop, and therefore then the breathing rate will gradually begin to come back to normal. So if I was exercising, I was getting really breathless, and I thought, right, I need to stop for a second. I'm going to adopt this position, leaning forwards, elbows or hands on the knees, and then literally from there, breathe in through the nose and out through the mouth. And I might do 5 or 6 cycles of those just to really get the air into the lungs, but at the same time force the air back out again to reduce that carbon dioxide level. So I hope that technique helps a little bit. I hope you found some of these other techniques useful, might help with your breathing day to day. And I'll look forward to seeing you on the next one next week. Thank you for watching. If you enjoyed this video today, please give it a thumbs up. You can also click here to subscribe to this channel or click here to watch a recent video. See you soon.